Hey there, leading ladies. Welcome to the Women Physicians Lead podcast. I'm your host, Dr. Lisa Herbert, a two-time best-selling author, speaker, family physician, and executive leadership coach with over 20 years experience of providing primary care and serving as a healthcare leader. If you are a woman physician ready to make a change in your career and have a seat at the leadership table, then you are in the right place. I'm excited to provide you with the crucial skills you need to be a successful leader and strategies to deal with workplace challenges. So put on your headphones and listen as we explore the new world of building women physician leaders. Hello, leading ladies, and welcome back to another episode of the Women Physicians Lead podcast. So I'm excited today to bring you another great guest, Jordyn Feingold. And Dr. Feingold is a resident physician in psychiatry at the Icahn School of Medicine at Mount Sinai in New York City. She has a lot to share with us today about well-being and positive psychology. And she's going to also talk to us about physician burnout, some things that we can do to thrive in the face of adversity, and learn a little bit more about what she is studying during her psychiatry residency and her research as well. So as noted, Dr. Feingold is a resident physician in psychiatry at the Icahn School of Medicine at Mount Sinai. She is a well-being researcher and a positive psychology practitioner. Her research and clinical interests involve the brain-gut axis, mind-body approaches to complex medical and psychiatric illness, protecting and promoting healthcare worker and patient well-being, and incorporating positive psychology approaches into healthcare delivery. She is the co-author of Choose Growth, a workbook for transcending trauma, fear, and self-doubt with Scott Barry Kaufman. So join me in welcoming Dr. Feingold to the Women Physicians Lead podcast. We're so excited to have you here today.
Oh, thank you so much for having me. This is really exciting.
Yeah, absolutely. So you have so much to share just in the brief bio that I read. There's a lot to unpack in terms of how you're using your residency in psychiatry along with your background in positive psychology to really sort of get to like you said, the mind-body approach to understanding complex medical and psychiatric illness. So when you think about your career journey thus far and the leadership journey that you're looking forward to as well, who or what may have been instrumental in that decision?
Yeah, it's such a good question because this really goes back to days before I was ever a doctor, back to even before I was pre-med, when I discovered that I thought a career in the sciences and in healthcare would be well suited for my personality. Growing up, I was the baby of my family and sort of like not officially ever a therapist, but I did play sort of a role in my family that was calming. And I being the baby, I was exposed to a lot of wisdom that I tried to soak up and eventually translate to my friends and peers growing up in school. And then I loved science. I discovered that I loved biology. I was fascinated by the digestive system when I learned it in high school biology. I can remember sitting there in my seat and just being captivated by my high school bio teacher, Miss Provost, teaching us about all of the way proteins and carbs get digested. And I was like, wait, maybe there's a future for me in medicine combining science and really this desire to help people and counsel people. And I always thought that being a doctor was about helping people to be healthy. And it wasn't until I just happened to be at the University of Pennsylvania for undergrad in Philly, and I was exposed there to this field of positive psychology that I had never heard about, which is the science of well-being and human flourishing above and beyond the absence of disease. It really wasn't until discovering that positive psychology existed that I realized that the biomedical model in medicine and Western medicine is very much about getting rid of what's wrong with people. So I figured before going to medical school, maybe I could actually formally study positive psychology, the science of well-being, so that I could integrate this framework, the sort of north side of the human experience, north of neutral, as one of the founders of the field calls it, all of the good stuff, and how we can bring that into what we do for patients in treating disease and curing illness, while also promoting what's right with people. So a lot of it was just being in the right place at the right time to be exposed to this field and then run with it.
That's interesting. Yeah. So, I'm glad that you are able to really pull from different sources. I think that's what makes us great physicians, or make physicians, great at what they do, is really being able to take into account all of the things that make up the human body and the way that we, kind of move about on this earth, and to bring in different dynamics in terms of healing, right? In terms of healing people as well. So when you think about your role now as a resident physician in psychiatry, what does that role look like for you? What does your day look like? Who do you serve, and what challenges do you face?
So my day is thus far in my training. So I'm a year and a half in, and every month has looked very different. So of course there was surviving intern year, which is notorious. And for us psychiatrists, it requires 6 months of non-psychiatry. So I was doing internal medicine and neurology and emergency medicine. I did a month in urgent care. So really seeing the full spectrum of human illness in all of its forms, the inpatient setting, the outpatient setting, the acute setting. And then I got to do 6 months of psychiatry, and mostly in the inpatient capacity, as well as in a partial hospitalization program. I'm located in East Harlem, like really the border between East Harlem and the Upper East Side of Manhattan. So one of the most diverse areas in terms of patient population and the population that I serve. And it's been just an incredible journey, what I've learned from mentors, teams, patients. And I also spend some time at the VA, and I'm about to spend the next 6 months working at the Bronx VA full-time, doing outpatient geriatric psychiatry and substance use. So it's been a lot, and I'm trying to soak it all in, and just, my primary job right now is to learn to be an excellent psychiatrist, which includes giving psychotherapy and learning all of the modalities. So psychodynamic psychotherapy, cognitive behavioral therapy, dialectical behavioral therapy, group therapy, and a psychopharmacologist. Of course, we do prescribe a lot of medications. And I think what really was the most transformative time thus far has been when I've been on the consult psychiatry service. So serving inpatients admitted to other medical services with psychiatric needs. And that's where the mind-body connection, I think, is the most profoundly in the front and center. The way that someone's experience with a physical illness can impact their mental state, and the way that their mental state can then subsequently feed back into their physical symptoms, and the way that we can intervene to help communicate with patients and their teams and their families to help them just make sense of what is happening to them. Because, as you know, it can be such a distressing experience to have physical illness, and that is only compounded by psychiatric illness and the way that all of those things intertwine. So yeah, it's been a lot. I feel like it's constant just whiplash going every month to a different service, but I'm still trying to piece together how it all fits in and how it will fit into my career eventually when I'm not doing something different every month. And I also wrote this book during intern years, we wrote the book Choose Growth, but when I graduated medical school through December of my intern year. So I was also working on this book and learning so much and integrating so much into the book based on what I was seeing and experiencing as an intern, that fight or flight response that I was living in when I was on inpatient medicine, and just like my body sensing that I was in danger similar to when my evolutionary ancestors were exposed to like the saber-toothed tiger, just because I maybe didn't know something on rounds, and how I had to learn and unlearn some of that fear response in order to be the most centered and grounded doctor I could for my patients. So as you know, and as the doctors listening to this podcast know, it is a whirlwind to go through residency training. And I think now the biggest challenge is just integrating everything I'm learning into the clinician that I most want to be.
Yeah. Wow, that's great. You've been very busy.
It's like an understatement. I'm like reeling thinking about it.
I think a lot of us, and I'm going to use the word older, but more seasoned physicians, right? I think a lot of us now are just realizing that we have these other loves and we have these
Mhm.
other passions, and we want to write a book, and we want to, maybe study outside a little bit of medicine to try to, integrate some different
Yes.
modalities as a physician. And you're doing that now as a resident, which is so great to see, because I think that that is part of what may help us, or prevent us from really going into burnout, is by really, looking at and discovering what it is we really want to become, who we want to become, and what are some of the things that we maybe want to do, outside of medicine, but still be able to practice.
It's it's so true. And you can hear the sirens. I live right right near the hospital. I know. So I really do think that that is a major key to preventing and then treating our own burnout is, going back and meeting ourselves where we are and recognizing what those other interests are. And even thinking back, like when we all applied to medical school, and even going back and reading that personal statement and seeing what activities were on there, however many years ago that was, because we all came into this field with so much vision and passion and extracurricular things that we did. You literally couldn't get into medical school if science or just medicine or research was the only thing. Medical schools
Right.
want well-rounded individuals. And then though, the tricky thing that happens is you get to medical school and it's so overwhelming and it's drinking from the water hose, it and then it's residency, and it's just the easiest thing to do is to let those other things fall by the wayside and just really take on that identity of healthcare worker and doctor, which can be all consuming. And then, for some of us, we have families and that takes over. And it's
Right.
like all of these passions that we had, it's just so easy to subvert them and focus more singularly on career and family and whatever else we are prioritizing. And I think I had this gift of foresight of studying positive psychology before medical school, which I recognize is an incredible gift, where I learned like what is well-being, like what are the ingredients that are going to keep me well so that I can have a sustainable career in medicine. And that sometimes meant in medical school like doing the bare minimum in the classroom so that I could work out every day and that I could prioritize dinner with my now husband, and making little tweaks that seem like they might be counterintuitive and almost like career sabotaging, but were actually the keys to like maintaining my sanity and well-being. And that doesn't mean I've never experienced burnout, but it's like when you have some of those things in place, it's much easier to squash it as it's happening and recognize it as it's happening.
Yeah, absolutely. Yeah. And I love the field of positive psychology. I'm definitely a supporter of it. When I was going through my own, period of burnout, I had decided that I was going to study, becoming a coach,
Mm-hmm.
but didn't really kind of know in what aspect I was going to, go through this particular certification, and ended up attending a certification course in coaching that was based in positive psychology. And it was the biggest eye opener for me. It helped me personally, as well as, to be able to use some of those techniques and principles for my clients as well. But I'm definitely, a huge supporter of it, and feel like we, as healthcare practitioners, can use it in our day-to-day practice. So what
Absolutely.
really motivated you to explore this field?
So, there are people I think who come to positive psychology and feel like, wow, there's a scientific evidence base for how to be happier. Like, I need that. And then for me, it was more like, this is just so intuitive. So I think there are people who come to positive psychology and really are moved to study it because they're looking for that evidence base on how to be happier or have more meaning in their life. And it's really coming from like I don't have this right now. I really need something. And this has this solid evidence base, and it's a science, and well-being can be learned and developed. And it's very it's a compelling way to dig your just get your fists in and learn a new skill set. Where I was coming from, when I discovered the field, I was an undergrad. Life was pretty good. I had very few cares other than, figuring out professional identity and relationships. But I discovered that there was this whole field out there that kind of validated the way I lived my life. I think I am very fortunate in that I tend towards like that a higher happiness set point, which is a concept in positive psychology. There's just, some of us based on genes and environment that tend a little bit towards the brighter, cheerier side. And that was definitely, it is who I was as a young person. And then, I think a lot of us in healthcare, that can almost get like, I think our happiness set points they can lower because we're so tired. And just fatigue, I think, can really undermine even a really happy, open-minded, go-lucky person. So once I discovered as an undergrad that there was a whole science of this, I think it was actually being in the room with people studying it that really cinched it for me. It wasn't just the books and the reading, which was so compelling. It was actually being in a room full of these students studying applied positive psychology at Penn. It's where the master's program is. And I was just brought into the room with them because I was in an a cappella group in college, and we were hired by the program to sing for these MAPP students, the Master of Applied Positive Psychology students. I think that's when it became real for me, that these people just like, they were drinking some Kool-Aid that I wanted to drink. They just, they seemed just so deeply well and connected with one another. And they were from all ages, from all over the world in this room together, studying the science of happiness. And I was like, whoa, there's something here that I need to really dig into. And medical school, God willing, will be there for me at the end of this journey. And I will be all the better for knowing this science to apply within medicine. And hopefully some schools will take this crazy science of happiness girl and hope that I could actually bring it to medical school.
Yeah, that's great. So like you mentioned, and what we've talked about briefly is this burnout, that our colleagues have been dealing with for some time now, even pre-pandemic,
Oh
right?
yeah.
However, the pandemic, like a lot of things, has brought the seriousness of it to light.
Yeah.
And the pandemic in and of itself has escalated, the rate of burnout. So share with us your experience, if you have an experience with burnout. What lessons did you learn? And what can we do now as physicians to prioritize our well-being and thrive? Hey, leading ladies, this is Dr. Lisa. I love bringing you great content and dropping pearls to help you lead with confidence. So don't go anywhere. We will be right back. Hello, leading ladies. It's Dr. Lisa. Ready to claim your seat at the leadership table? Well, let's partner together. I believe that when a physician learns the crucial skills they need to step up and lead, positive change happens in their own life and community. So, ready to talk? As a physician and certified executive leadership coach, I provide training and support for physicians who want to feel confident in their ability to lead and be the respected voice in healthcare. So if you book your free 30-minute consultation today, we are going to analyze where you are in your career and identify the specific support you need to lead successfully. And if we're a good fit, I will provide you with the solution that is best for you. So I look forward to learning more about your leadership journey and how I can support your growth. Go to www.justtherightbalance.com/physician consult. That's www.justtherightbalance.com/physician consult. Hey there, leading ladies. It's Dr. Lisa. Thanks for hanging in with me. Now back to our amazing interview.
Yeah. So I was in this position studying burnout well before I ever experienced it. And studying it, it became clear that it was such a ripe area to apply positive psychology, because I was like getting ready to write my thesis, my capstone on what I was calling positive medicine, applying positive psychology in the medical space. And, there's numerous ways we could do that for patients, for clinicians, for teams. And in talking to many doctors, almost unanimously, everyone I spoke to was like, you gotta focus on physicians, because this was in 2016, so well before COVID, and this epidemic of burnout that they were experiencing. So, I dug into the literature to try to understand what this phenomenon really was and how prevalent it is. And, I learned pretty quickly that it's a well-defined syndrome of this emotional exhaustion, depersonalization, starting to see patients as objects, and low sense of personal accomplishment, really losing touch with all of the progress we're making and the impact we're having, that begins in the workplace and then can really trickle into one's personal life, family life, and cause all sorts of badness like substance use and mental illness and even suicide. So I spent this whole summer, 2016, writing my capstone, thinking about positive interventions for medical students, trainees, and doctors. And I get to medical school, and on the third day of class, we had a student die by suicide in my institution. And it was this like horrific, terrible, tragic, like coming to light of like what this problem and related problems, what untreated mental illness or even treated mental illness can look like within our field. And it really accelerated my institution. They had always, at Mount Sinai, there had always been a pretty robust offering of mental health services and even an attention toward wellness, but this event catalyzed that even more. And it led, as a first-year medical student with an expertise in positive psychology, someone like me, to actually really contribute, even though I knew nothing about what it meant to be a medical student or a doctor. I did have this background, and I was able to bring some programmatic positive psychology based programs to my school, which still, thankfully still exist. And I even led a group today for co-residents on the power of gratitude. So some of the programs we started do still exist today. We developed a course for doctors. But then, of course, knowledge and knowing the science is not always enough, because then I found myself as a third-year medical student in about February, realizing that I was on my neurology rotation, and, the year had been pretty good, but like any third-year medical student in the Northeast in February, it's dark, the days are short, you're exhausted, you're at the bottom of the totem pole, you don't know what you're doing. And I realized it was like, as I was going to write my boyfriend at the time, my now husband, a Valentine's Day card, I was like, I have no access to my emotional reserve right now. Like I'm like either good or bad. There is no gradient of emotion that I'm experiencing right now. And I was like, whoa, like, am I burnt out? Like me, who like developed our programs at my med school to prevent burnout, who studied positive psychology, who teaches a course on this, like, whoa. And that was a huge reckoning for me, that, sometimes knowing something is just not sufficient. Like you can still be susceptible to these things. And what I did to sort of like work my way through that, like realizing that I was burnt out, I started to write some poetry, and that led me to send some of the poems that I wrote to my classmates. It fostered connection. It was tapping into something that I did as a high school student that I hadn't done since maybe college.
Yeah.
And it was really healing for me. And even just to make that, diagnosis for myself, like, Jordyn, you're experiencing burnout, and meet myself with compassion, and then apply some of the skills that, self-compassion and gratitude, and figuring out how to use my character strengths to navigate this period. I did come out of it. And I think pretty much since then, I've been able to recognize, like, sort of days where I feel burned out, and maybe even weeks. It's usually due to insufficient sleep and, like, not having my, like, most basic needs met. But I think now I do more just, like, check-ins with myself. And it hasn't been as big of an issue, but I have to be very diligent about, like, using my skills and embracing what I know works for me for keeping my well-being high.
Yeah, yeah. Thanks for sharing that story. I think that's going to resonate with so many of our listeners. And I think at the culmination basically of what you were saying is one is that we have to really develop this level of self-awareness of what's going on with ourselves, right? Where are we sort of on the
Mm-hmm.
emotional spectrum, on the physical spectrum,
Mm-hmm.
so that when we do recognize that these things are starting to develop, that we can start to take action and maybe do things a little differently. And then to also recognize what are the things that we can tap into that can sort of lift us up and bring us that joy. Like for you, it was writing poetry, right?
Mm-hmm.
So for other people, it may be other things, but what is that thing or things that you can do to sort of
Mm-hmm.
lift you out of those, sort of somber moments, right? And then doing the check-ins with yourself, taking time, being really intentional about that, is important as well. So tell us a little bit about any sort of model maybe that you may have developed, or when you're talking about your course and your program, what are some of the things that you follow in order to help physicians with well-being?
Yeah. So this is, like, the core of the class and what I've been working on personally. It all comes down to this acronym called REVAMP, which is an acronym. And I love it because it's also a call to action for how, as physicians, as human beings, we can really take ownership, and move the needle on what we know matters most for our well being. So revamp, it's the 6 ingredients, and it starts with relationships, the single most important factor when it comes to well-being and life satisfaction. So relationships with close personal others, relationships with our patients, our colleagues, our teams, those in sort of like our hierarchy, interdisciplinary staff, as well as the relationship we have with ourself, which I think is really critical. Um, the E is about engagement. So, like, how are we spending our time on a day-to-day basis? Are we finding flow in what we're doing? Are we bringing mindfulness and non-judgment to our day-to-day moments as they unfold? And how do we, like, use the best parts of ourselves in our daily life? The V is vitality. So thinking through, like, how am I tending to my energy? Am I getting enough sleep? Am I putting nourishing foods into my body? How does, like, am I just eating all the sugar that's around me in the hospital, or am I actually, like, eating foods that are sustaining my energy throughout the day to meet the demands that I'm working toward? The A is accomplishment. So if burnout is about, like, low sense of personal accomplishment, that A is about reconnecting with the impact that we're having, and the impact not just for ourselves for furthering our own ambitions, which for some of us is important and more important for some than others, but really how are we helping other people, and how are other people helping us to achieve our goals? The M is meaning. So connecting with something that is larger than ourselves. This is so different for different people. It gets into sort of existential questions of our existence, like, what is our purpose on this planet? What is our personal purpose? What is our mission? How are we living by our values? And then finally, the P in revamp is just the positive emotion. So these states of positivity that we evolve to almost ignore and over attend to the negative experiences that happened because those were more critical for our survival. But how in this modern day, when our lives are not in danger like our ancestors were on this like moment by moment basis, how do we really attend to the positive states of being and deepen them and savor them and prolong them as much as we can?
That's great. So that's the revamp model. And yeah, so I love that. All of those acronyms that you mentioned, or the acronym with the explanation that you mentioned is important, right? All of those letters are important in terms of our well-being. So, what do you think it would take for organizations to support physicians, especially during these times where we're finding, burnout being at its highest rate, and we're finding a lot of physicians exiting medicine, leaving medicine? Um, what would it really take for healthcare organizations, do you think, to support physicians during this time?
It's such a complicated question. I wish there was a simple answer. I think the first thing is really leveraging leadership, because what we found at our institution is that one of the most protective factors during the pandemic of people feeling supported and protected from burnout and all of these negative psychological sequelae was feeling supported by leadership. And that is like a very interpersonal process, right? Of course, it's organizational and systemic in the fact that like this is a leadership structure and we exist in this hierarchical setup, but it's also really one-on-one communication. How can I support you? What do you need? Because what we know from positive psychology is that well-being is not a one-size-fits-all intervention. What's going to work for you may not be what I need, just based on our own psyches and our own like home lives and structures and family life. I think really honoring this fact that as doctors, we are so much more than just doctors, that we are parents and we are children and we are experiencing so much outside of the workplace, almost encouraging people to bring more of their human selves into the workplace, to bring out that human side of us, not in like an unprofessional way, but to be more of ourselves, to have more human to human connection and build on the positive relationships in the workplace. I also think it's about like basic needs. Like it would be great if I could have like a healthy hot lunch at my workplace and have access to mental health resources covered by my insurance that I can actually utilize during 9 to 5 business hours when therapists work. So it's really like, I think in these conversations, there tends to be this like dichotomy or like a binary between like individual level interventions like therapy and mindfulness-based interventions, and then like the systems-based interventions like reorienting leadership and more paid time off. I actually think it's a false dichotomy. I actually think they're much more integrated, that if like leaders can hear the needs of their constituents and be there to support them with systemic and individual based interventions, I really think that's the key.
Yeah, I think you're right. I think you're absolutely right. I think that, when I talk to some of the clients that I serve, or talk to some of my colleagues, the best organizations, or the people who feel like they work for the best organization, are those that have leaders who actually have like boots on the ground, right? Like they're in there, they're in the day to day, they're interacting with the staff, they sort of know what's going on, they have a pulse of what's going on, within different departments. They're seen, they're not just kind of someone who's up in an office somewhere and they don't have any, connection or contact to. So I think you're right. I think that leaders who really show that they are concerned and who offer support to their staff, can really do a lot for the well-being, of not only physicians but for the healthcare workforce in general. Yeah. So tell us what do you do for self-care? So we talked a lot about, the importance of well-being, and everyone sort of has their own sort of routine, I think, that they sort of
Mhm.
get into or sometimes fall out of. But what does self-care look like for you? And what does that even mean for you?
Yeah. So there are some like concrete things that I do, and then there are many more sort of just like ways of being that I've come to embrace over the years. In terms of like the concrete stuff, I'm in therapy twice a week. So my own psychotherapy that has been incredibly helpful. I started
Mhm.
during my intern year. I've done family therapy, so I've invited my parents to come to therapy with me, with a separate family therapist to avoid any conflicts of interest, which has been great. I work out every day. So I do some form of physical activity. I try to do it in the morning before work. I have a Peloton. I'm a bit of a Peloton junkie. I love it. And doing that before work helps me manage my energy and feel that sense of accomplishment and like that I'm doing something just for me, like before I even step foot in the hospital. It's a little harder on medicine when I had to be there at 6 a.m. That didn't always happen, but since I've been on psychiatry, it's been possible. And then I think like prioritizing friends and social life is huge for me. Friendships are like incredibly valuable to me. My relationship with my husband, spending quality time, having date night to really carve out special time. And then, so those are sort of like the concrete operational things. And then I think being as self-compassionate with myself as possible. It's like not a hard skill, but it's really like an orientation to my life where I really try to see myself as a human being with flaws, part of a shared human experience, and always recognizing that I am my worst critic. Like I am my harshest critic, and that I can be softer with myself when I find myself going into that negative internal dialogue. You're not doing enough, or you just sounded like an idiot. Really calling myself out and working on that. And embracing like a grateful orientation to life, practicing gratitude formally through, reflective practices before bed, but really more like savoring life as it unfolds, learning to slow down, enjoy a meal slowly. I try not to eat at my desk. Like I try to enjoy the positive things that happen that a couple of years ago I would have just taken for granted and said this is just life, but I really try to slow those things down and get more out of them on a daily
Yeah.
basis.
Yeah, that's great. And so, as we sort of wrap up this wonderful discussion that we're having, what three tips can you give our listeners on thriving in the face of adversity? Leading as a woman physician and caring for ourselves.
Yeah. So the first thing is a self-compassion tip. Treat yourself like you treat all of the people you care for in your life. Like as women, we tend to be, some are more nurturing than others, but we tend to be nurturers, caregivers. All of us in healthcare were caregivers, and we give so much of ourselves to other people, and remembering that you really can't pour from an empty cup. So how can we do for ourselves first and foremost the way we do for others? Put that oxygen mask on yourself before putting it on everyone next to you. I think that's tip number one. Tip number two, I think, is prioritize relationships. When I am in a slump or I'm having that negative internal, lizard in my brain that is coming to the surface, typically, if I can't be that own self-compassionate voice for myself, someone I love can. So it's like calling my mom or calling my dad or my husband or a friend. And even when it feels like I should be working or I should be working on this paper or something that is like a work product that will make me feel quote unquote productive, probably the better thing for me to do in that moment is go for a walk, socialize with a friend, make a phone call. So prioritize relationships, even if it might be counter to what we like have to do. And then I think maybe the third thing, and it's all related to these other two, is be careful of the shoulds that we give to ourselves. I should be doing this, or I should feel this way, or I feel like I should have XYZ that other person has. I think, Karen Horney, who's a humanistic psychologist, says, beware of the tyrannical shoulds. And I found when I stopped shoulding myself to death, I feel a lot better, and I see more things as opportunities rather than obligations. And just that reframe can really change, what it means to walk into a patient's room, or what it means to go home and watch TV. Like I should do this. No, I can do this, or how might I do this differently? So practice self-compassion, prioritize relationships, and beware of tyrannical shoulds.
I love it. I love all three. So thank you for sharing those tips with us.
Of course.
Well, this has been a very engaging, enlightening discussion. So interesting to learn about the work that you're doing. And best of luck to you as you move forward in your career, as you finish your psychiatry residency, and as you do more of your research and more of your well-being, the courses, the work that you're doing for physicians. We are truly grateful for you and thankful for all of the work that you're doing to really help us out. So
thank you so much.
Yeah. And we look forward to having you on the show again.
Yes.
In the future. Keep us updated as to what's going on. And if anyone is listening to this podcast, how can they reach you, follow you? And do you have anything that you'd like to share with us?
Absolutely. So I'm on all the socials, LinkedIn, Instagram. I'm Jordyn Feingold. So Jordyn is the only complicated thing to my name. It's Jordyn with a Y. And I would recommend, if anyone's really interested in the topics that they heard today, to think about either listening to or purchasing the book, the physical copy of Choose Growth, a workbook for transcending trauma, fear, and self-doubt. It's available pretty much everywhere. And it's just a really practical way to put some of this knowledge into concrete skills practice. I think I'll be working on the practices the rest of my life.
Great. And I'm sure that that's a great resource for anyone who's listening. So I'll be sure to also put that in the show notes as well, so people can access that. So again, thank you for being a guest on our show, and good luck to you, and Happy New Year 2023.
Happy New Year. Take care.
Great.
Thank you for listening today and for allowing me to be a part of your career journey. To continue receiving leadership support, I invite you to join our private Facebook group, Building Women Physician Leaders, at www.leadingladiesinCharge.com. Until next time, take care.